Hello friends, my name is Ikenna Ojiegbe from Easy Click to Excellence in Midwifery. The topic we are going to discuss today is dysmenorrhea, which is a type of menstrual disorder. Dysmenorrhea is defined as a difficult or painful menstruation caused by uterine contractions. Dysmenorrhea occurs when the uterine muscles contract too strongly during menstrual cycle. As a result, the uterine muscles compress the uterine blood vessels, thereby cutting off oxygen and blood supply to the uterus. It is this lack of oxygen that causes pain during menstruation. Now, types of dysmenorrhea. We have two types of dysmenorrhea, which are primary dysmenorrhea and secondary dysmenorrhea. Now, primary dysmenorrhea. Primary dysmenorrhea is a menstrual pain which is not as a result of any gynecologic disorder, but includes relation with the normal process of menstruation. Now, let's talk about the characteristics of primary dysmenorrhea. Primary dysmenorrhea is a common type of menstrual cramps or pains that are recurrent and are not due to other disease conditions. The menstrual pain usually begins 1 or 2 days before or when menstruation begins. This pain is usually felt by the woman at the lower abdomen, the back, or the thighs. The pain can range from mild to severe and typically lasts for 12 to 72 hours. The pain can also be accompanied by nausea and vomiting, fatigue, or even diarrhea. Primary dysmenorrhea usually becomes less painful as the woman ages and may entirely stop after the woman has delivered her first child. Primary dysmenorrhea is most common during late adolescence and in the early 20s. Now, causes of primary dysmenorrhea. Primary dysmenorrhea is thought to be caused by excessive levels of prostaglandins, which are physiologically active lipid compounds that make the uterus to contract during menstruation and childbirth. The uterus contracts throughout menstrual cycle, but contracts more strongly during menstruation. As the uterus contracts too strongly during the time the endometrium is sloughed off, the uterine muscles compress the uterine blood vessels, thereby cutting off blood and oxygen supply to the uterus, which lead to pains. Now, factors that may worsen the pain of primary dysmenorrhea. These factors include retroversion of uterus, which is when the uterus tilts backward instead of forward. Also, if the woman has longer, heavier, or irregular menstrual period. Lack of exercise, that is sedentary lifestyle, could also worsen the pain. Other factors include psychological or social stress, smoking, drinking alcohol, or taking stimulants such as caffeine. Being overweight or having a family member who experienced menstrual pains could also be implicated. Or if the adolescent attains menarche before the age of 12. Now, let's talk about the secondary dysmenorrhea. Secondary dysmenorrhea is a kind of menstrual pain that is generally attributed or related to a gynecologic disorder or problems. This kind of dysmenorrhea is more likely to affect women during adulthood. Now, causes of secondary dysmenorrhea. Secondary dysmenorrhea is usually caused by a disease in the female reproductive organs. Reproductive disorders that could cause dysmenorrhea include endometriosis. This is a condition in which the endometrial tissues are found outside the uterus. They could be found inside the fallopian tube, in the ovary, or even on the perimetrum. Another condition is known as adenomyosis. This is a condition where the lining of the uterus, known as the endometrium, grows into the mucous layer of the uterus, known as the myometrium. Others include sexually transmitted infections, pelvic inflammatory disease, cervical stenosis, uterine fibroids, and ovarian cysts. Sometimes the use of intrauterine device as a method of birth control could also worsen secondary dysmenorrhea. Now, symptoms of dysmenorrhea. Symptoms of dysmenorrhea include pain at the lower abdomen, hips, lower back, or thighs. Other symptoms include nausea and vomiting, fatigue, headache, lightheadedness, and diarrhea. The pain could be spasmodic, that is a sharp pelvic pain or cramp at the start of the menstrual flow. Or the pain could be congestive, that is a dull, aching pain. The symptoms of secondary dysmenorrhea usually start sooner during the menstrual cycle than in the primary dysmenorrhea and usually last longer. In about 10% of women with primary dysmenorrhea, the pains are usually severe. Now, the diagnosis of dysmenorrhea. The diagnosis is usually through history taking, the signs and symptoms the woman is presenting, and physical examination, including pelvic examination, to check for abnormalities in the female reproductive organs, and also for signs of infections. Some radiological investigations may be prescribed, including ultrasound, CT scan, MRI, X-ray, and laparoscopy. These investigations can help to detect any deviation or abnormality in the reproductive system of the woman, such as endometriosis, adhesions, uterine fibroid, ovarian cysts, ectopic pregnancy, and others. Treatment of dysmenorrhea. Treatment of dysmenorrhea include the use of analgesics such as ibuprofen, naproxen sodium, diclofenac, and others. If these drugs are taken a day before her menstruation begins, they could help to control pains or cramps. Or she could start taking the medications as soon as her menstruation starts or when she feels pain. She is also expected to continue taking the analgesics for 2 to 3 days or until the pains are relieved. Another treatment measure is the use of hormonal birth control drugs. Oral birth control pills and other forms of hormonal contraceptives contain hormones that prevent ovulation and reduce the severity of menstrual cramps. The third measure is surgical operation. If the dysmenorrhea is caused by a gynecologic disorder such as endometriosis or uterine fibroid, a surgical operation may be used to correct the problem, thereby relieving the symptoms. Also, in severe or life-threatening cases of dysmenorrhea, surgical removal of the uterus may be recommended. Now, let's look at the lifestyle and home remedies for dysmenorrhea. First, the woman is encouraged to take enough rest and sleep, which will help her to reduce stress and cope adequately. Besides having adequate rest and sleep, there are other things the woman should try, such as exercising regularly. Physical activities help some women to ease menstrual cramps and cope better with dysmenorrhea. Women who exercise regularly usually have less cramps. Therefore, it is advisable that the woman makes exercise her daily routine. The next remedy is application of heat or hot compress. Soaking in a hot bath or using heating pad, hot water bottle, or heat patch on her lower abdomen may ease menstrual cramps. The next remedy is the use of dietary supplements. Some studies have shown that the use of vitamin E, omega-3 fatty acid, vitamin B1, vitamin B6, and magnesium supplements might reduce menstrual cramps. Reduction of stress. It is also advisable that the woman reduce physical, social, and psychological stress, because these forms of stress could aggravate menstrual pains. Now, psychotherapy. Because the woman may be anxious, there is need to reassure the woman that the pains will reduce with good medical interventions. The next remedy is avoidance of stimulants. It is advisable that the woman avoids foods that contain caffeine. Also, the woman should abstain from smoking and alcohol during this period. Another remedy is the application of gentle massage. The woman may experience reduction in pains and improved comfort with gentle massage at her lower abdomen and back. This is the end of today's video. Thank you for watching our videos. Don't forget to subscribe to our channel, hit the notification bell, and give your comments in the comment section below. I also encourage you to watch our previous videos on menstrual cycle and premenstrual syndrome. Don't forget to like our videos, subscribe to our channel, hit the notification bell so that when we release a new video, you'll be the first to see it. Also, share with your friends and put your comments in the comment section below. Thank you.